Why are cases rising as vaccine accessibility also increases?
7 investigator Heather Catallo with more on the confusing situation.
We are seeing an upward trend in COVID cases, positivity, and also hospitalizations, and I'm very concerned about that.
The city of Detroit, like much of the state, is in the midst of a bizarre balancing act. There are several options for those who want to get vaccinated, but the virus continues to surge.
The majority of new cases continue to be those who are 20 to 29, which is about 22%, and 30 to 39-year-olds, right around 18%.
While these younger age groups only became vaccine eligible recently, the vaccines are now available, making it a race to get people in for shots to stop the spread.
Hear us when we say don't wait and get vaccinated.
The focus on young people and cases is seen far beyond the city of Detroit.
We really have a race between the vaccination, which is coming, and we're getting a lot more of it, and the infections, which are right now we're in a fourth surge.
Dr. Ora Peskovitz is a pediatrician and the president of Oakland University. She made news this week with her announcement that the campus will require vaccines for all students living on campus this coming fall. And that's not all. The university is now working with the state, county, and Rite Aid to run a vaccination clinic for students, faculty, and staff.
Even though many students have mild disease or they're even asymptomatic, I worry that they could carry the virus home with them. And I worry especially now because we really have a race between the vaccination, which is coming, and we're getting a lot more of it. And I'm especially worried about the variants, which are increasing.
According to lab testing company Helix, the UK variant, which is considered more deadly and transmissible, makes up 70% of Michigan's new cases. The state leads the nation when it comes to the rise in variant cases. But as we've learned throughout the pandemic, a surge in cases can have more than one culprit.
It is possible that the variants are definitely playing a role in this whole thing. I would say that that's certainly not the only factor.
Amy Gordon is an associate professor of epidemiology at the University of Michigan.
I think in general, people are kind of getting exhausted.
With many older, more at-risk individuals vaccinated, Gordon believes younger people are also just letting down their guard more.
A lot of them, I think, were holding their kids back from doing things while they were kind of looking out for their parents or higher risk individuals in the kids' lives.
She says the hope now is to get as many people as possible vaccinated.
There's two ways to get to herd immunity, either through vaccination, which is certainly preferable, or infection.
Health officials stress that while getting vaccinated is the best way to stop the spread of COVID-19, they say don't forget to practice the other measures that we know help curb cases like social distancing and wearing a mask. I'm Heather Catallo, 7 Action News.